6.3% of people in the United States have COPD, according to the COPD Foundation's website. My grandpa has been living with COPD the last 3 years, and I have seen firsthand the toll it takes on the body. You hear commercials on TV for inhalers and other medications, but until you understand how an individual feels without these things, you may not understand the need for them. By addressing the causes, symptoms, and treatments used for COPD, you will be able to better understand the disease. Chronic obstructive pulmonary disease is a progressive disease that makes breathing difficult, and it includes two main conditions, emphysema and chronic bronchitis. According to the American Lung Association, in 2011, 12.7 million U.S. adults 18 and over were estimated to have COPD. However, close to 24 million U.S. adults have evidence of impaired lung function, indicating an underdiagnosis of COPD. The National Heart, Lung, and Blood Institute states that the smoking is the number one cause of COPD. However, long-term exposure to chemicals and or dust particles may also contribute to COPD. A very rare cause of chronic obstructive pulmonary disease is a genetic condition, alpha-1 antitrypsin deficiency, and the deficiency of this protein can lead to lung damage and, as a result, COPD. Less oxygen flows in and out of the airways because the alveoli, or the air sacs, become less elastic, and the walls of the airways become thick and inflamed. With more mucus being produced in the lungs, it can cause the airways to clog. And in this picture right here, you can see that this is a healthy alveoli, and on the bottom it shows an unhealthy alveoli with tissue damage, and you can see kind of the hardening of the alveoli, and up here they look softer and spongier. If a person has emphysema, the walls of the alveoli are damaged and they become loose, or they are completely destroyed, which decreases the lung function. And if a person has chronic bronchitis, the lining of the airways are irritated and they will thicken, forming excess mucus, which obviously makes it more difficult to breathe. Symptoms of COPD include a cough that produces a lot of mucus, shortness of breath, wheezing, chest tightness, and fatigue. Severe symptoms that would require medical attention include hard time catching breath, lips or nails turn blue, a fast heartbeat, or the individual is not mentally alert anymore due to the lack of oxygen. Identifying treatment options would depend on the individual, but lifestyle changes are always a great idea, and avoid lung irritants. Obviously, the individual should quit smoking and avoid secondhand smoke, which may irritate their lungs, and follow a healthy eating plan to fulfill the nutritional needs of the body, and find out what activities are safe to help you keep active and help improve your wellness and breathing. If an individual chooses not to be active, the muscles in the body become weak and they function less and more poorly than an individual who has shortness of breath but can continue to stay active. Medicines that can help COPD are bronchodilators, which make the bronchioles bigger and help open the airways. Combination bronchodilators or inhalers can also help do that. Pulmonary rehabilitation, basically breathing exercises to help get your oxygen capacity back up and possibly help repair a little bit of the damaged alveoli. And oxygen therapy might be needed at nighttime so that the individual can get rest and feel well rested because they do have more oxygen in their system. After listening to my speech today, I hope that you have learned how to prevent COPD by recognizing the causes, and I also hope you understand the symptoms and treatment options for individuals with COPD.